chronic disease. There's no cure for it, but you can keep it controlled. So identify and minimize contact with the triggers, understand and take medications as prescribed, which is a key thing that we do as patient education. Monitor it so you understand when your symptoms are starting to get worse, because you might not realize it right away by yourself. And then know what to do when your asthma gets worse. So know how to use that rescue inhaler, and know to stay on your long-term inhalers. And if you if there's some leeway, maybe take a little bit more of that steroid inhaler when things, you know. So if pollen's bad, like I have tree allergies, so spring is really bad. So if I had asthma, I might have to increase my medications a little bit more during that time. But be aware of it, because you don't want to get into a serious exacerbation of it.
When we had the fires, it was terrible.
Oh, I'll bet you it was terrible. And the pulmonologists aren't there all the time, right?
They're there, but we're booking 3 months out. We have, like, in all honesty, we're lucky if we have one acute visit available a day, and it's gone 4 days before.
Right.
It's crazy. And they sit through lunch and stay late most days.
I did my externship in pulmonology, and there were days there were no doctors there because they were all in the hospital or off because they'd been in the hospital all night or something. So there, it was hard to get an appointment way back then.
Was it here in town?
Yeah, it was with Peace Health. So, why would we use inhaled steroids instead of oral or shots? And we've already talked about that. Fewer systemic side effects, and it is topical, hits the targeted site better. See, I keep getting ahead of myself. Side effects of the inhalers, though. Sore mouth or throat, hoarse or croaky voice, which I feel like I have now and I'm not taking any. Paradoxically, it causes a cough, which it's trying to prevent. Oral thrush, which is a yeast infection, fungal infection.
Rinse and spit.
Rinse and spit. And nosebleed. So they do say to prevent that, do your inhaler, rinse and spit. So that you spit out any that's caught on your mouth and closer throat, not deep throat, but so rinse and spit. Oh, you like that one? But if you don't treat your asthma, you can cause scarring and irreversible asthma. Sleep disturbances, because you know if you can't breathe, you can't lay down, you can't sleep well. And we're learning more and more about sleep. Sleep deprivation causes a lot of problems through lots of our areas of our lives. Decreased physical activity due to shortness of breath. You can't play tennis when you're having an asthma attack, and if it's not under control. Poor work performance and school performance. So with kids, this is really important to keep their asthma under control and work with the parents to keep that under control. There's increased anxiety because, you know, if you can't breathe, you're more anxious, and everything in your life is a little more anxious. Hospitalization. And the most severe of all of them, most irreversible, is death. What?
Lost a friend to asthma 2 years ago. Just couldn't get to the hospital in time.
Yeah. Not to pass judgment, but just a question. Do you think monitoring it closer, like doing this twice a day, could have helped, or was it something so sudden that
it could have helped. She was one of these people that, I don't need to take my corticosteroid. I can get away without it, and and they tried to get her to the hospital, and she was gone by the time I finished.
That's one of the reasons we don't like the term rescue inhaler, because it's not a rescue inhaler.
Right,
It's a fast-acting, tiny step. It's not a rescue inhaler.
right. I've always thought nebulizers work better than inhalers too.
We do, but insurance doesn't really like to cover
Yeah.
nebulizers.
Oh, they used to do
We
that
fight
better.
and fight and fight.
Insurance is a big thing, yeah.
And it changes every year. So, once the year's up, then you start over with new formularies, and it's,
Good thing to know for students who only one showed up, but it's always changing.
Yeah.
And so, we teach about insurance, but we can't teach any details. Like, this insurance company covers that because,
It won't
Next year
by
they
the time you
won't.
graduate.
yeah.
and, things are always changing. So, signs that it's poorly controlled. So if you have a family member who's poorly controlling, or you have a patient come in, shortness of breath during exercise or routine activities, maybe even walking from the waiting room back to the exam room, will show you that they're not really working on controlling this. Coughing at night, coughing from a cold that lasts longer than a week. So hospitalizations, so your patients who are hospitalized more often, it's showing that they're not really controlling it. Sorry, rescue medication required more than 2 times in a month, so you shouldn't be using those all the time. But people think that's easier. So this is the fun one for the night. It's a seemingly paradoxical idea, smoking a plant to alleviate constriction of the airways, but it works. Of course, smoking is far from the cleanest method of delivery, but it's been known since 1973 that THC acts as a bronchodilator because of the work of Dr. Tashkin. He and his team at UCLA investigated the effects of smoked cannabis and ingested THC in the lungs and found that both methods of intake dilated the airways. So maybe some of your patients need some medical marijuana. I don't know how workplaces view that, but
We've got anxiety and increased dilation.
Yeah. Interesting.
yeah, I thought that was interesting.
That doesn't make sense. I never thought of it.
Well, people ask me about smoking pot and what it does to your lungs, and I don't think there's a whole lot different than smoking tobacco. But I always find it interesting that generally the same group of people fighting tobacco are encouraging smoking pot. It's bad for your lungs, period. Smoke is smoke. I mean, there is more tar in tobacco, but still, it's just not good for you to be inhaling anything like that. So, this one's clear. I'm glad this shot shows better on here. So normal airway, asthmatic airway, and asthmatic during an attack. So, so that really is a lot smaller than the normal airway, and that's why it feels like you're breathing through a little straw, because you are.
And there's a mucus in there that is constantly moving and blocking air passage too.
Mm-hmm.
Obstruction
Right.
versus restriction or combination, when you get all that flowing.
Seems like on top of that, even the anxiety of just freaking out because you can't breathe
Makes it worse.
even worse.
Right.
Hence the rescue inhaler 20 times a day.
Right. Because they call it a rescue inhaler and they think it's rescuing them.
It works. It works really fast, but
It
it
does.
only works for a very short period of time. That's why you have to stay on the long term
Right.
to get the true effect.
Now see, I'm not on any medication. And if they try, they'd fail because I cannot remember to take my vitamins every day. I can't imagine if I had blood pressure medication that I had to take all the time. I'd be
You'd have
I'd-
high blood pressure.
I'd have high blood pressure. Exactly what I'd have. Because I can't remember it. And I've tried every trick. They're beside my bed. My vitamins, I cannot take a vitamin every day. And then I'll go, when was the last time I took vitamins? I probably should do that. Well, I forget. I can do a patch, but I don't change it every week. I'd have to have a patch that was very forgiving. So it's not intentional that I'm non-compliant. It's because I just don't remember to do that. If I owe you money, it's not because I don't want to pay you back. It's because I forgot again.
That means we could convince you owe us money.
You probably could. So, any
Memory bank.
questions? Thank you for all your input. Your knowledge is more current than mine. Yes?
One thing, I was a 4-H leader for many years, and I had my parents ask them to let me know if their kids had asthma, and I had to have a rescue inhaler when we went camping and things, and I put the kid's name on it, because when your child's having an asthma attack, and if he's off camping or doing something, the leaders may not have a clue, and the kid may not know where his inhalers are, so.
Yeah,
That's something to remember if you have an asthmatic in the family, is to,
make sure you.
if they're on a trip or something with a group, make sure the group leader has access to the inhaler or has one.
Knows what to do.
That is a really good point.
And that they actually know how to use the inhaler.
Yeah.
So that was, I worked with Boy Scouts, and that was one of the things we needed, and insulin was the other one.
Oh, yeah,
Right. Insulin, we usually had, I don't think we ever did an outing with a diabetic kid that didn't have a parent with them.
We used to get, we had a very fragile type 1 diabetic, and we had saddlebags specially packed for her, with an ice pack and one in her insulin and one in snacks in the other. And
Yeah.
we'd be in the middle of a mountainside and have to stop and check her blood sugars because we learned the warning signs, and so she never got left it behind. But
Right.
we had some very interesting injections on the side of a mountain.
Yes.
Horses scrambling to stay on its feet.
One of the Boy Scouts I know just did a 50-mile hike through, in the Ross Lake area. And both his parents went with him because they had to have somebody.
yeah.
He doesn't wake up to the alarms at night
Uh-huh.
for his blood sugar. And I think he's 16 or 17 now, and he's 5 years in, but he doesn't wake up. So his parents have to always be checking him.
Yeah. I never had been around the fragile one before.